Crohn's disease is a disease that affects the gastrointestinal tract and the digestive tract. Bacteria that is normally passed through due to its benign nature is mistaken for a harmful substance, and the immune system goes into defense mode against that bacteria. There is no known cause for Crohn's disease right now. However, heredity and a malfunctioning immune system are the two main risk factors. Diet, stress, and environment are also known to be activators for the disease. Crohn's disease and ulcerative colitis are two forms of IBD or inflammatory bowel disease and have very similar symptoms, so may not be diagnosed as either one. So when looking at statistics, you're looking at statistics of people with all forms of IBD, and that is about 1.6 million Americans. So IBD typically affects more women than men and more Caucasians than any other race. However, it can affect anyone, and it usually affects adults, but it can also affect children. Every patient's prognosis will be different, as the disease is different for everyone. So the prognosis will depend on how the disease changes over time and how the body responds to things in your treatment plan, so medications, surgeries, dietary changes. Some patients may experience very mild symptoms, or some patients may experience very intense symptoms or severe, or times of flare-ups where the symptoms are extreme, and then times of remission where the symptoms are little to no symptoms at the time. So in the mild category, there's frequent diarrhea and mild abdominal pain, and in the middle, there is more severe abdominal pain, weight loss, significant anemia, fever, and severe symptoms may include fever, persistent vomiting, more severe weight loss, high fever, and obstruction and abscesses of the bowels and intestines. So there are no current cures for Crohn's disease right now. However, there's lots of treatment that patients can do to cope with the symptoms that they will have. So you can have surgery, you can do dietary changes, and you can take medications. So medications will range from anti-inflammatory drugs, immune system suppressors, antibiotics, anti-diarrhea, pain relievers, iron supplements, vitamin B shots, and calcium and vitamin D supplements. So nutrition therapy may range from just having a special diet or special diet, as well as medications or special diet that is actually given to the patient through a feeding tube. Also, almost half of patients with Crohn's disease will require some form of surgery. During surgery, the surgeon will remove a damaged portion of your digestive tract and then connect it with a healthy section.